Good afternoon. My name is Adrian Dix. I'm BC's Minister of Health. To my right is Dr. Bonnie Henry, BC's Provincial Health Officer. On the phone is Dr. Sue Pollock, who's the Chief Medical Health Officer for the Interior Health Authority. Well, I'm honored today to be on the territory of the Musqueam, of the Squamish, of the Tsleil-Waututh First Nations. We're honored to be here in Vancouver on their lands. Dr. Pollock, as you know, is in Kelowna. I want to start by saying that how important it is. I want to start really every presentation by saying how important it is for people to get vaccinated against COVID-19 right now. As of the end of day yesterday, 6,993,104 doses had been administered in BC. That means this morning our 7 millionth dose would have been administered. 3,796,146 of those are first doses. That represents 81.8% of people over the age of 12. In addition, 68.9% of people will have received their second dose or are now fully vaccinated over the age of 12 in BC. Today we're going to talk about the situation in the central Okanagan local health area. I want to say that it's in the course of the pandemic, different areas of our province at different times have faced challenges. And I want everybody who lives in Kelowna and West Kelowna and Peachland and Lake Country and Rutland, in the whole communities involved who are being affected by transmission, to know that we are with them, that public health is with them, that Dr. Pollock's teams are with them, that the contact tracing and the support for people who are sick and the work that's being done in public health is standing with them at this time, because it is challenging, and we've seen this before in other communities, from Prince Rupert to Whistler to Surrey to other communities that have faced challenges over time. Right now, as you know, last week, measures were put in place in the central Okanagan local health area, measures to address the situation there, outbreak of cases there. At that time, we have about 89 local health areas across the province. About half of our cases in the week prior to that being done were in the central Okanagan local health area, and the other half were in the other 88. So it was a significant situation. And action was taken consistent with our strategy, which is to focus in this time of vaccination specifically on regions, sometimes on businesses, and to address outbreaks as they occur. As of today, 56.24% of our active cases are in the Interior Health Authority, the vast majority of those in the central Okanagan local health area. 46% of our cases across BC in ICU are in the Interior Health Authority, 37% of our hospitalizations. And it continues to be a significant situation. As Dr. Henry noted yesterday, all of our cases in ICU yesterday were amongst people who were unvaccinated. And so I want to encourage everyone today, before we turn it over to Dr. Henry to talk about, and Dr. Pollock to talk about the measures that we're going to take and add to the central Okanagan local health area, that anyone living in Kelowna or West Kelowna or Lake Country or Rutland, or anyone in the region, and then of course everyone across BC who has not received their first dose of vaccine, it's important to book your appointment today or go to one of our drop-in clinics and get vaccinated. More important than ever, a key measure that you can take to protect yourself and help your community today. And so I want to encourage everyone to do that. And so with that, I'm going to say that, as you know, our strategy is changing, and we're focused on the situation in the central Okanagan local health area. I want to turn it over to Dr. Bonnie Henry to describe some of the measures that will be taken to assist in dealing with high levels of transmission in that local health area. Dr. Henry.
Thank you very much, and good afternoon. I'd like to begin today by actually thanking everyone in Kelowna and throughout the central Okanagan who have stepped up over this past week. We know there's a lot of work that has been going on, particularly for those who've been immunized. There's been a great push who are getting the first doses into people and second doses. And the interior health teams have been out providing vaccine in workplaces, in community centres, in the yacht club, in areas where people can access it. And I also want to thank the case and contact management teams in Interior Health. They have been working very closely with people in the community who've been affected by this, who've had family members who've ended up in hospital. The challenges that we're facing continue to face with this virus. I also want to commend the environmental health officers who are working with WorkSafe, working with the various industries, businesses, who are feeling the impact of this outbreak in the central Okanagan. And I also particularly want to call out the restaurants and the hospitality industry who have been really supporting their staff to be able to get immunized, recognizing that these are people that are most affected by the outbreak that we're experiencing right now. So thank you for what you have been doing to protect yourself and everybody in your community. As you know, we have been watching this outbreak very carefully, and despite the measures that were announced a week ago on July 28th, we're still seeing cases growing, mostly among unvaccinated people or those who've only received a single dose of vaccine. And unfortunately, we're now seeing spillover into our healthcare settings, especially long-term care. We have 2 outbreaks in the central Okanagan and 2 additional outbreaks in long-term care. And it's affecting the lives of the residents and staff in those facilities. And also now we're seeing dozens of staff members in acute care settings who've been infected. And that puts stress on our healthcare system across both the central Okanagan, but all of the interiors. We know that Kelowna General, for example, supports all of the interior health region. And this is at a time where we continue to see strains from the wildfire activity and increased health needs from smoky skies and from heat. Under-immunized young people, mostly between the ages of 20 and 40. That's where we're seeing this spread. The outbreak is being driven by the rapidly moving strain of the virus that we've started to see. About 80% of the cases now in interior health are with the Delta strain, and we know that it can spread so much more easily, and that is what is driving the rapid transmission in younger people, as I mentioned, mostly between the ages of 20 and 40. And we know that many people in this age group were the last to access vaccine, and for many of them, the case counts had come down. It may not have been a priority with the many different things that people have going on in their lives. We also know that this age group of people are the most connected, and that's whether that's through work, through social connections, through family, with children, and other competing issues. Most of the transmission events we are seeing are through social gatherings, whether that's in vacation rentals, people coming together and having parties, in bars and nightclubs that we've seen. We've seen transmission in fitness centers and personal gatherings, from parties to weddings to other events. So we've been working with Interior Health very closely over these last few days to try and really understand where transmission's happening and what are the things that we can put in place that will help stop the transmissions as we increase the number of people who are protected through immunization. So we now need to take additional restrictions to slow the transmission of COVID-19 in this region. And as the Minister mentioned, this is part of our approach now, where we have high levels of immunization and pockets of areas where transmission is a risk. So this outbreak is being dealt with regionally, and beginning today, new local orders will be in place from Dr. Sue Pollack, who's the Chief Medical Health Officer for Interior Health, to help us manage this outbreak in the central Okanagan. I'm going to read through these restrictions and have a few comments, and then I'll turn it over to Dr. Pollack. So in terms of personal gatherings, outdoor personal gatherings will be limited now to 50 people. So that's birthday parties, the backyard barbecues, your block parties. Indoor personal gatherings will go back to where we were before, where you can have your 5 people or 1 other household. We're putting additional restrictions on organized gatherings to help reduce the numbers of people that are being infected right now. So indoor seated organized gatherings will be limited now to 50 people with our COVID safety plans that we had in place before. Outdoor organized gatherings, again, limited to 50 people with a COVID safety plan in place. In terms of businesses, we know that there are some that have been differentially affected by the transmission in younger people, and we're, as of today, we'll be closing nightclubs and bars. Restaurants will be go back to having limitations on some of the indoor and outdoor dining, so groups of up to 6 people. They are not restricted to your own household, but earlier provisions, which we had in place for craft breweries and wine tastings, will also apply, and liquor licenses will be limited to liquor serving until 10 p.m. There are casinos in the area, and they are under very strict reopening plans, and they can remain and operate under these current guidelines and restrictions, but must comply with the restaurant guidance that we've outlined. In terms of fitness and facilities, the indoor low-intensity group exercise will still be able to continue with capacity limits, and indoor high-intensity group exercise will be suspended for this period of time. We know that it is a place that people go to have vacations, to meet up with others, and now we need to limit the numbers of people who can be in vacation rentals, accommodations, including houses, boats and houseboats, to limit to 5 people plus the occupants. Very similar to what we had in place last summer when we started to see transmission in these events that were happening in the vacation rentals. The mask mandate, of course, that was implemented last week by Interior Health will continue to be in place for all indoor public places. And to remind people that this mask mandate is enforceable by bylaw officers and environmental health officers in the Central Okanagan. We know that many people have plans already, and there is a transition plan for this weekend. If you have travel planned this weekend to the Central Okanagan, we strongly consider that you change your travel plans, either reschedule or postpone. There are many things going on in the Central Okanagan right now that need the attention of the local community. If you have already made plans and are there right now, these restrictions on parties at rental accommodations do apply. But for events planned this weekend, we know that we can't change those immediately. What we need you to do is ensure that you have safety plans in place, that as much as possible, unimmunized people should not attend these events, whether it's a wedding or a birthday party or a formal organized event. People should wear masks, they should stay seated, and follow physical distancing rules. Really important were people to keep a list of who is at these events. We know that now there has been transmission from people who've traveled to the Central Okanagan and moved back to different areas of the province. We need everybody who has been in that area to self-monitor. And if you're at an event this weekend, make sure that you know how to contact the people who are at that event so that we can warn people if transmission has happened. If you have symptoms, getting tested right away is important. So the events and gathering orders will be enforced beginning next week on Monday. All the other measures that I've outlined around bars and restaurants, nightclubs and sports will take effect today. We are also strongly recommending that people avoid non-essential travel to and from the Central Okanagan, and do not come if you're not immunized. If you have traveled recently to the Central Okanagan, you need to know that this virus is spreading rapidly. It is much more transmissible, as we have seen in other parts of the country and other parts of the world. You must monitor yourself for symptoms and get tested if any arise. This is not where we want it to be, obviously, right now, and we know, however, that we can make a tremendous impact in slowing this virus down. We know what works, and we know that this is a focal outbreak. There is absolutely increasing levels of transmission in communities around the province. We expected this when we knew that we were going to have more social connections, those much needed social connections that we have not had for these last few months. But stopping the spread when we start to get this rapid increase, particularly among people who are not yet protected, means that we have to take additional measures in this area. So stopping the spread to those we are closest to, protecting those who are at risk, those who can't yet be immunized or for whom immunization doesn't have as strong an effect because their immune systems may not be as strong as others, means that vaccination rates, getting vaccinations up, will make a difference in stopping this outbreak and preventing any further ones. We know that this is a challenging time for people in the central Okanagan and all through the interior health region, living with the challenges of this pandemic, but for many who are also living with the challenges of wildfires and wildfire smoke. These steps, we believe, will allow us to contain the transmission of the virus in this area while we continue to increase vaccination rates and make concerted efforts to make it available to people across the Okanagan. Now more than ever, it's critical for people to roll up their sleeves and get the vaccine. We know that vaccines have changed this game in our measures to get through this pandemic, and that we will make a difference in time. Thanks to vaccines, we have the tools now to stop outbreaks in their tracks, and that's what we need to do now. If you're in the Okanagan, the best thing you can do to get through these restrictions is to get vaccinated today and encourage everyone in your life to do the same. That's how we get back to doing the things that we love and being with the people that we love. I'm now going to turn it over to Dr. Sue Pollock, Chief Medical Officer of Health and Interior Health.
Good afternoon. Thank you, Minister Dix and Dr. Henry. Today, I'm joining from the traditional territory of the Syilx people, and I'd also like to acknowledge that Interior Health is home to 15 Métis chartered communities and situated on the traditional territory of 7 First Nations communities. As Minister Dix and Dr. Henry have said, the Central Okanagan COVID-19 outbreak continues to develop. Last week, Interior Health placed a regional mandatory mask order, strengthened immunization and testing strategies, and we re-emphasized the Step 3 restrictions needed to slow and reduce the spread of COVID-19. Unfortunately, we're here today because these measures have not led to significant reduction in COVID transmission throughout the Central Okanagan. Just in the past week, the outbreak has almost tripled, rising from about 320 cases when we declared the outbreak last Wednesday to approximately 1,200 cases today. We have over 700 active cases. We have 31 individuals who are hospitalized and 10 in critical care. We continue to see that the majority of the individuals who are new cases are unimmunized young adults, mostly ranging in age from 20 to 40 years of age. As COVID circulation continues to increase across our communities in the Central Okanagan, it's also begun to creep into our long-term care homes, and as has been mentioned, has led to the declaration of the 2 Central Okanagan long-term care facility outbreaks. This is impacting our staffing at hospitals and in the community. It's preventing people from accessing home and community care services, and it's beginning to impact healthcare services throughout the region. In other words, this is impacting everyone, and we're not moving the dial quickly enough with our immunizations. People who are not immunized at this point in time, I ask you to please take this seriously today and take these measures seriously. We really need your help to bring this outbreak under control. So given this new COVID activity that we are experiencing, new measures are required, as have been outlined, to take clear and direct action to slow the transmission across the Central Okanagan. This will resemble a circuit breaker measure where we pause some of the activities that are contributing to this rapid COVID-19 growth. So in addition to these new orders that have been announced today, we also need to continue to focus on our immunization. We're calling on all of the young adults living in our communities across Central Okanagan, especially for those of you who work in jobs where you interact with the public, to please come out and get your vaccine. We will make it as easy as we can for you to do that. It's the most effective way to bring this Central Okanagan outbreak under control. We'll be continuing our immunization ground game wherever we can. This has included pop-up clinics at various settings across our communities, including farmers markets. We have the Kelowna Yacht Club in the downtown Kelowna area that's been very effective in seeing people accessing dose 1. And we'll also be focusing on our post-secondary institutions as we move closer to September. As well, immunizations are especially important as we approach the school year for our elementary and high school students. As we know, anyone born in 2009 or earlier is eligible for their vaccine, and we ask you to come out. I also want to remind everybody that we have reduced the interval in the Central Okanagan between the first and second doses to 28 days. So anyone who drops in now for vaccine can be immunized with their second dose by the start of the school season. Before I conclude, I want to thank everyone who has dropped in over the past week for their immunizations. We so appreciate your efforts, and please tell your friends and neighbours that they should be getting their vaccine as well. We've also been working very closely with the BC Food and Restaurant Association, and we thank you. We thank the service industry members throughout the Central Okanagan, all of the businesses who are helping us, and, of course, our teams here across Interior Health who are working so hard right now. We're grateful for everyone's support. We know it's asking a lot to bring these restrictions back in place, and we're asking more of you right now to get through this challenging time. But I know that people across the Interior and the Central Okanagan are resilient, and we will get through this together. Thank you.
Thank you very much. We're happy to take your questions now.
As a reminder to reporters on the phone, please press *1 to enter the queue. You will be limited to one question and one follow-up. Please also remember to take your phone off mute. You will not be audible until your name is called. Our first question today is from Keith Baldry, Global. Please go ahead.
Oh, hi, thanks for this. Speaking of the school year starting, I know yesterday you talked about how healthcare workers may face or maybe have certain vaccination rules in place that you're working on. I'm just wondering if that's going to apply to people working in the school system in the coming school year. Would teachers or support staff need to be vaccinated in that situation?
Obviously, we want everybody in the school setting who's eligible for vaccination to be immunized. And as I also mentioned yesterday, we are continuing to work with our committee provincially, with the Ministry of Health, Ministry of Education, with school superintendents, with teachers, with other school staff. And we will be coming up with the latest guidelines around the updates to the guidelines that we put out in June will be coming out in the coming weeks. So all of those questions will be addressed as in the coming weeks.
Keith, did you have a follow-up?
Yes, on behalf of a colleague, I know you've been asked this before recently. Just Quebec is now offering a third dose to facilitate travel. I'm just wondering where we're at in terms of that situation.
Yeah, and we're not at this point. It is much more important for us to, as Sue called it, to continue our ground game to get people immunized here, to stop transmission here. That is our focus. And the issue of what is being accepted for immunization for travel is very much in flux. And that is in flux both across this country, but we are working with Canada. We're influencing with our colleagues to the south in the United States. We're working as well with the WHO to ensure that that all of the WHO recognized vaccines are acceptable for travel in countries around the world. So I just tell people, be patient. There is no need now for a third dose. Things are changing rapidly in countries around the world. More and more data of the effectiveness, particularly the effectiveness of mixed schedules, is becoming apparent to people. And Canada is leading in some ways around that, but we are not the only country that is using AstraZeneca, that's using mixed AstraZeneca and mRNA vaccines, that's using mRNA vaccines interchangeably. There are many other countries that are doing that too, and we are seeing that things are being revised by other countries on an almost daily basis. So these things will settle out over time.
Our next question is from Marcella Bernardo, News 1130. Please go ahead.
Hi, Dr. Henry. I have to ask you if you're starting to consider whether or not it was smart to tell people that it's okay to no longer wear a mask when you're going into a store or into other indoor places, because we're seeing many people ignoring those protocols, not just in the Central Okanagan, but across British Columbia, and it's causing a lot of heartache and headaches for people who wish that you would have just kept that mask mandate in place.
Yeah, I think that's a really good way of putting it, Marcella, because in no way did we ever say that it's not appropriate. I have said repeatedly and continue to say people must and should wear masks in indoor public spaces. particularly when you're around people, if it's crowded indoor spaces where we know this virus can be transmitted. That remains the recommendation, that remains in place, that remains what people should be doing. And it is mandated in the central Okanagan right now as well.
Marcella, did you have a follow-up?
I have to ask this as well because I know I've probably asked this a million times in the past year and a half, but what's being done to step up enforcement in the central Okanagan? Because we are seeing videos of young people partying in the streets and gathering in large groups. So how can we ensure that if people aren't going to do this to protect themselves, that other people will step in to make sure they're not letting this virus spread as rapidly as it has been in the past few months?
So we know that there's different levels of risk depending on the situation, and outdoor settings are much safer than indoor settings, and we do very rarely see that transmission in outdoor settings. But yes, it is important, and the new restrictions, these are orders, so they are enforceable. And in the last week, and maybe I'll turn it over to Dr. Pollock to talk about some of the initiatives, but the Interior Health, the environmental health officers have been working with WorkSafe, with the restaurants, with business associations to step up enforcement around these issues and to protect staff, because we hear again from staff that it can be very challenging, particularly later in the night when people have had a bit to drink, and in certain situations that is where we're starting to see, that's where we've been seeing transmission happening, and that's why we're focusing the restrictions that are coming in today on those settings. And Dr. Pollock, perhaps you can add to that.
Sure, thank you very much. So following the declaration of the outbreak last week, we have had our local teams out in the evening time and throughout last weekend. So these are environmental health officers from Interior Health alongside WorkSafe BC, and we've had great support from the municipality as well through local bylaw to go to these different establishments, especially those that are open in the evening and later into the night. To provide education, and this will continue through this weekend as well, provide education on the measures and requirements of the orders. And for the most part, our teams are reporting back that they're seeing quite good compliance with the measures and orders. And we really have relied on the cooperation of the BC Restaurant and Food Association and our local businesses. I think that our local businesses want to get through this as quickly as the rest of us do. So we'll continue to have those teams out on the grounds.
Our next question is from Moira Witten, the Tyee. Please go ahead.
Hi, thank you for this. New interim modeling from the BC COVID modeling group released today used evidence from the U.S. and Europe to suggest that BC could see close to 1,000 daily cases within the next couple of weeks and even 400 hospitalizations by the end of September. That's more than what we saw during the second wave. With cases rising in all health areas, are these local restrictions enough to prevent BC as a whole from following the devastating trajectory data from other jurisdictions suggests we could be following?
Yeah, so I think we need to be have a bit of a qualification around some of the modeling that's been released by certain groups, and I talked about this the other day. We also have we've modeling that's been released federally that we've looked at from the BC CDC team, which also partners with modelers from SFU and UBC. And it really, the one factor that makes a huge difference is immunization. So we know that even a small increase, and some of the federal modeling we were looking at yesterday, even a 10% increase across the board at each age group can make a tremendous difference in the trajectory of the transmission. Even with Delta, we know that these vaccines are still very effective against that virus and can smooth it out. And we're seeing a decoupling, a delinking of hospitalizations. So these are all things that help us understand. Modeling doesn't tell us what's going to happen. What it does is tells tells us which are the factors that are important and which are the ones that we need to focus on to prevent widespread transmission and hospitalizations. And the most important factor is protecting people through vaccination. We know that it reduces your risk of transmitting to others. It reduces your risk of getting infected yourself. And if you do get infected, you're not as likely to transmit and you don't have a severe illness. So those are things that are incredibly important. That's why we're focusing on where we're seeing outbreaks, taking those measures that prevent those transmission settings. So the settings where we're seeing transmissions happening until we can get that vaccination up. And it's not surprising to us that it is in areas where we have higher numbers of unimmunized people that we're starting to see this transmission happen. So yes, I expect that what we're doing in the central Okanagan will make a difference. It takes time, as we know, because what we're seeing today reflects transmission events that happened a week to 2 weeks ago. So these are the measures that we need to follow in the central Okanagan, but it means that we need to have the same thinking across the province. We have very high rates in many different age groups in different parts of the province, but there are pockets. And there are pockets where there are people who are non-immunized or still only have a single dose, and that's where the virus can take off. So we'll be focusing on those. We started with our walk-in Wednesday with some of the immunizations that are available, and whether it's Kitts Beach or all of the places that we've been out providing vaccines to people. And that's the key, and it is the key that we've seen in other places around the world as well, and the modeling confirms that. I don't know if you wanted to say anything.
Moira, did you have a follow-up?
Thank you. Dr. Henry, also earlier this week, you said BC was on track to enter stage 4 reopening on September 7th. But in May, when those steps were laid out, you said that the requirement would be low and stable cases and hospitalizations for stages 3 and 4 to continue. Is 400 daily cases and rising your definition of low and stable? And how can British Columbians trust your decisions are based on the thresholds you previously laid out if we do stay in stage 3 or move ahead to stage 4?
Yeah, well, you know what? When we see local outbreaks, which is what we expected, we're taking these activities, these actions today to address those local outbreaks. So if we think of the 400 cases yesterday, over 60% of them were in the central Okanagan. So yes, we are monitoring things over time, and that's what we have said we're going to do. We had thresholds of immunization that we had to meet before we'd even consider moving there. We've met those. And so yes, we need to continually evaluate the evolving situation that we're seeing. You know, this is something that we have learned in the last 18 months, that we need to readjust. We need to understand the increased transmissibility that we're seeing with certain strains of the virus, and you know, those are the things that we are looking at on a daily basis and will continue to. So right now, we're taking the measures that we need to address the situation we're in today, and we'll continue to do that, and we'll continue to tell you as we learn more.
Our next question is from Nick Johansson, Castanet.
Hi, Dr. Henry. With the recent transmission largely limited to unvaccinated or partially vaccinated people, why are you including everyone in these orders, specifically around gatherings? For example, is it unsafe for a group of 20 fully vaccinated people to socialize indoors?
Yeah, you know, and the limits were 50 indoors, so you know, that is a personal risk assessment that people need to make. But what we're doing is putting in the measures that are addressing those situations where we're seeing transmission events happening. So yes, we are taking specific targeted measures at those areas where we're seeing a lot of transmission happening, mostly in younger unvaccinated people. So yes, if I was having a wedding, for example, I would be very sure that only people who were immunized were coming. Those are things that we can do to protect each other. We know that more than 80% of people have at least one dose, so that makes a difference across the province. But right now, when we're seeing a lot of transmission of a highly transmissible virus, we have to take measures to protect everyone, and that's why we're doing it in a local area like this.
And Nick, did you have a follow-up?
Yeah, you spoke about, I think you said 31 hospitalizations now in the interior. Are these hospitalizations still largely among unvaccinated or partially vaccinated people? And can you speak to the age of the people that we're seeing hospitalized in this recent wave? And are there any differences with this Delta variant as far as the age of hospitalizations?
Yeah, and I'll ask Dr. Pollack to talk to that in more specifics, but in general, what we're seeing absolutely is under-immunized, so people have only had a single dose, or unimmunized people being hospitalized. But there have been some people who have been fully immunized, mostly older people, so people over the age of 70. And that tells us that as we're older, we may not mount as strong an immune response. Another reason why it's so important for us with this highly infectious strain that's circulating to take those measures to protect those that can spill over into an older population, or people who are immune compromised, or children under the age of 12 who have not yet been immunized. So I don't know, Sue, if you wanted to add something to the details around the hospitalizations.
Yeah, thank you for that. So I mentioned 31 hospitalizations today, and majority of those cases are in the Kelowna General Hospital, so in the central Okanagan region. We are seeing hospitalizations across the different age groups, and as has been mentioned, I'm primarily in partially immunized or unimmunized individuals. And that is a change from what we saw previously, where we tended to see hospitalizations in the older age groups. So it is a bit more spread out now across the different age groups.
Our next question is from Hina Alam, Canadian Press.
Clarify where, to begin with, where the restrictions are. Is it all of the interior health, or is it just central Okanagan? I wasn't very clear on where the restrictions are. Thank you.
Sure. It is the central Okanagan, and I'll let Sue define what communities that is. It doesn't mean the risk is zero in other parts of the Okanagan or interior health. We know that people move around quite a bit, but these are the most connected communities.
Yeah, thank you, Bonnie. Thank you for that question. So the outbreak declaration and the measures announced today are specific to the communities of Peachland, West Kelowna, Kelowna, and Lake Country. So those are municipalities, but also include parts of the Central Okanagan Regional District and First Nations lands as well within that area. And as Dr. Henry said, we are carefully monitoring any spillover into other communities in the interior health region. So, we are aware that people from our own health authority outside of Central Okanagan are traveling to Kelowna and then going back home. So we're keeping a very close eye on numbers elsewhere in the region.
And did you have a follow-up?
I did. I was wondering if you could tell me what the rate is at which the Delta variant is now growing per day in BC, and what our positivity rate is right now. And thank you for this, Dr. Henry.
Thanks. So we don't measure the rate of the different whole genome. It takes a day to get the whole genome sequencing for each of the cases. We're doing whole genome sequencing on all of our cases in BC, but there's a lag time for that. So we report that on a weekly basis. What we're seeing with the Delta, it's up to, I believe it, on a provincial basis, it's about 60% of our cases now, and another 30% or so are P1 or the Gamma, and Alpha has come down, so the UK variant. It's a smaller percentage. Those data, the provincial data, are on the BC CDC website, and you can click on the link and it pulls up the graph over time and the percentage by health authority. What we're seeing in the interior health is about 80% of the cases in the last, since the beginning of July, are now Delta, and about, I wrote this down actually, somewhere here. It was 80% Delta and about 20%, close to 20% were the Gamma, the P1.
Our next question is from Christopher Folds, Kamloops This Week. Please go ahead.
Hi, yes. My question has to do with post-secondary education in September. We did a story about Thompson Rivers University in Kamloops preparing and whether they're going to require vaccination. And they had mentioned that they're expecting international students to arrive unvaccinated or with vaccinations that might not be approved here. I was kind of taken aback by that. How is that possible? Does the provincial government have authority over that, about international students coming to Kamloops without vaccination?
So there's a couple of things. One is to be able to come into Canada, they need to show their immunization status. And yes, we have a whole process that we're working through with the universities about international students to ensure that if they have, if they're not yet immunized with a WHO-approved vaccine, that we can catch them up on arrival. So there is a process that is in place to be monitoring that for all of the international students that we're expecting to start arrive. The BC Immunization Committee, our National Advisory Committee on Immunization, and we've been working with our provincial committee with the post-secondary institutions to make sure that vaccine is available for anybody who is able to come into the country and is not yet caught up with an official vaccine. So all of that is being worked out. It's all part of our process to ensuring that we can have safe reopening of post-secondary institutions. A really important part of the process.
Did you have a follow-up?
So hi, it's Sue. I just wanted to add in a question from Kamloops that our interior health local operations teams are working with all of our post-secondary institutions in all of our communities to ensure that we can have a vaccine available to students as they're arriving and to have a vaccine available on campus. So those plans are well underway.
Okay.
Sorry, Christopher, did you have a follow-up?
Yeah, one follow-up related to that, but it's related to the previous comments about hospitalizations among vaccinated and unvaccinated. I may be missing it, but is there anywhere on the daily briefings when they send out the numbers or somewhere on the BC CDC site that has specific numbers saying, you know, there's 300 people in the hospital, there's 290 with one vaccination, there's 10 with two vaccinations? Because wouldn't more information bolster your message that people should get vaccinated if indeed the vast majority are unvaccinated? Couldn't we have like specific numbers on that?
We do, and we post those weekly on the BC CDC website that we updated today, I believe. And what we have is in aggregate. So on a day-to-day basis, the hospital knows the status of the individual, but provincially what we do is we link and we connect that information. So we do have that breakthrough case information. It's been posted on the BC CDC website for the last couple of weeks. This will take us to the end of July, I believe, for this week. And what it shows is that of the cases, the vast majority are still, about 5% of cases are in fully immunized people. Hospitalizations, it's down to about 4% of hospitalizations are in fully immunized people. And same with deaths. They're still very rare in immunized people.
We have time for one more question. Our last question today is for Rob Monroe, Info News. Please go ahead.
Hi, this may be for Dr. Pollack, but you said that there's an increased spread of COVID amongst healthcare workers. Do you have any idea of what percentage of healthcare workers are vaccinated, and why so many are getting infected here?
Yeah, hi, Rob. I don't have that exact number in front of me. We can certainly get back to you with that number. But we certainly are seeing in some of our long-term care homes and given some of the lower immunization rates that healthcare workers who are unimmunized are becoming infected.
One of the other things that's important that we've seen, we saw it in a long-term care outbreak in Fraser Health that was with the Delta variant as well, is that once it gets into a long-term care home, it can spread even in a vaccinated population. It doesn't cause a severe illness, which is the good news in people who are immunized, but it is so transmissible that we are still seeing illness in at least positive tests in healthcare workers and residents with the Delta variant, which is another one of the reasons why we need to stop that spread, slow it down till we can get more people protected.
Did you have a follow-up?
Do you have any idea why there seems to be some reluctance on healthcare workers to get vaccinated? I know you don't have the numbers, but it seems, a bit lower than it should be.
Absolutely, and obviously this is something that we have been working on for some time. We prioritized healthcare workers, particularly in long-term care, very early on for immunization because we knew how devastating this virus can be in all of its strains. And early on, there was a lot of people who had questions, and that's understandable. We now know a whole lot more, and as I've said repeatedly, it is incumbent on us as healthcare workers to do everything, both to keep ourselves healthy so that we can serve the people who need us, but also to ensure that we're protecting those that we are serving, and particularly in long-term care. So yes, my expectation is that every healthcare worker in long-term care will be immunized unless they have a valid medical reason why that can't be possible, and we are working to that aim. I agree with you that we need to do more to make sure that people's questions are answered, to make sure that access is there, and now we are in that place in our immunization program where we have vaccine, we have a lot of information about the safety and effectiveness of these vaccines, and this is the time where people need to be immunized, and particularly in long-term care.
That's all the time we have for today. Thank you, everyone, for joining.
Thank you very much.